I have no disclosures. I thought this year that it would be great to just give you an overview of really the history of interventional cardiology and just give you some fun facts. The development and maturation of cardiac catheterization and angioplasty have really revolutionized, as we know, the diagnosis and management and treatment of cardiovascular disease. Although interventional cardiology is a relatively new concept, the progress by the field since its introduction rivals that of any other major medical disciplines. And to quote Sir James Mackenzie, who was a Scottish cardiologist who really studied heart rhythms, he said, "There are three stages in the history of every medical discovery. When it is first announced, people say that it's not true. Then a little later, when its truth has been borne in on them so that it can no longer be denied, they say it's not important. After that, if its importance becomes sufficiently obvious, they say that anyhow it is not new." How true that is. So just to give you a little history, in 3000 BC, the Egyptians performed bladder catheterizations using bronze, gold, and silver pipes. In 400 BC, during the time of Hippocrates, air and water were pushed through catheters made through hollow reeds and brass pipes into cadaver aortas to study the function, actually, of heart valves. William Harvey showed that arteries and veins form a complete circuit starting at the heart and always leading back to the heart. He was the first person to correctly describe the blood's circulation in the body. In 1711, the earliest known cardiac catheterization was performed by Hales when he inserted brass pipes through the venous and arterial systems into the ventricles of a horse by route of the jugular vein and carotid artery. The term cardiac catheterization in 1844 was coined by Claude Bernard, a French psychologist, and he used catheters to record intra-aortic pressure in animals. And a true fact about him is his wife divorced him because of his cruelty to animals. In 1929, Eberswald in Germany, Dr. Werner Forssmann performed the first documented human catheterization. And then our own at Mount Sinai, we have a couple of things that we're really excited to talk about, or to gloat about, I should say, as Arthur Master developed the first stress test at the Mount Sinai Hospital in New York City. In 1941, Cornard and Richard employed the first catheter as a diagnostic tool for the first time, utilizing catheter techniques to measure cardiac output. In 1956, Forsman, Cornard, and Richards earned a Nobel Prize in Medicine for developing a procedure that allowed for cardiac catheterization. In 1958, the diagnostic coronary angiogram, the key to selective imaging of the heart, was discovered by Dr. Mason Sones accidentally during a procedure. And in 1964, the transluminal angioplasty, the concept of remodeling the artery, was introduced by Dr. Charles Dotter. And then we get into Dr. James Black, who was a pharmacologist rather, who really invented beta blockers. He actually won a Nobel Prize, if you will, for this, as well as developing the drug, which a lot of us who are young enough to remember, Tagamet. David Cushman and Miguel Andenti developed ACE inhibitors. And Akero Endo was a scientist who really looked at and developed what we know as the statins. And this was revolutionary for us. In 1964, Desmond Julian was the first to propose and set up coronary care units, which today provide specialty care for people who have suffered a cardiac event such as a heart attack. And that was in 1964, so we've come a long way. He was a British physician. And then in 1974, Andreas Grunzig performed the first peripheral human balloon angioplasty. He also in 1976 presented the results of animal studies of coronary angioplasty at the AHA. In fact, in 1976, he again presented the animal studies at the AHA, and in 1977, the first human coronary balloon angioplasty was performed intraoperatively by Grunzig, Dr. Meyer, and Dr. Hanner in San Francisco. Andreas Grunzig is the father of interventional cardiology, and he performed the first PTCA on an awake patient in Zurich Starting with this case, all PTCA data from that is now entered into a worldwide registry. The first PTCA cases were performed in America by Dr. Myler in San Francisco and Dr. Sturzer in New York. Grunzig conducted the first demonstration course in Zurich, Switzerland, attended by 28 pioneering physicians. And that really, from there, they started the International Dilatation Society. In 1980, Grunzig conducted the last of 5 demonstration courses in Zurich with Dr. Sohns, Judkin's daughter, in attendance before moving to Atlanta, Georgia, where he became the director of interventional cardiology at Emory University. The National Heart, Lung, and Blood Institute began supporting the existing PTCA registry, and the first 1,000 angioplasties were performed worldwide. And that's also at the time, 1980, where guide catheters were introduced. In 1982, over-the-wire coaxial balloon systems were introduced. Additionally, brachial guiding catheters and steerable guide wires were developed. In 1985, sadly, the catheterization pioneers of Dr. Daughter, Sohns, Judkins, and Grunzig all passed away within 9 months of each other. Alan Kreber, an interventional cardiologist from France, performed the first balloon valvuloplasty. In 1986, coronary atherectomy devices were introduced, and Drs. Jacques Paul and Ulrich Segwart implanted the first coronary wall stents in Toulouse, France. And then another Mount Sinai, 1989, Dr. Klaus Peter Reintrop, with his colleagues, conducted the first study of intracoronary thrombolytic and acute MI infarction at Mount Sinai Hospital. 1981 to 1993, taking you through the advancement in the 1900s, a large number of new interventional devices were invented and perfected. Some, such as lasers, turned out to be less effective than were hoped for. However, others were approved and used worldwide, including the rotational atherectomy device, the rotoblator, which Dr. Sharma is known as the master, and the intravascular ultrasound IVUS and stents. In 1994, the Palmal-Schatz stent was approved by the FDA for use in the United States. Wow, have we come forward. Stents in 1994 to 1997, stents became commonplace and eliminated many complications. The theory of dual plate therapy for the prevention of stent thrombosis was conceptualized in France in 1966, and you'll be hearing more about that from Dr. Sweeney. In 1997, actually in 1986, Dr. Ottavio Alfieri suggested to Dr. Mehmet Oz, the one that we see on the talk show, who is a heart surgeon, that the mitral valve would only need one structure to close the valve, which led to Dr. Oz theorizing and developing the mitral clip, which he patented in 1997. How lucky he is. Over 1 million angioplasties have been performed worldwide, making angioplasty the most common medical intervention in the world. In 2001, almost 2 million angioplasties were performed worldwide, with an estimated increase of 8% annually. In 2002, Alan Kreber performed the first TAVR procedure in the world, which has revolutionized the practice of interventional cardiology. In 2003, the first drug-eluting stent, the Cypher, manufactured J&J and Cordis, was approved by the FDA, marking a major advance in the battle to reduce restenosis to single digits. And in 2004, Boston Scientific gets its Taxus drug-eluting stent approved. Many studies are published demonstrating the vastly improved outcomes. And you can see that. These are just common milestones that really don't pertain to what we're talking about, but just if fun facts. You can look at the slides after. So then the Mount Sinai. Mount Sinai opened their first cath lab in the Rose Pavilion in Annenberg in 1982, and then we came over in 1991 to the Guggenheim Pavilion. As of 8/3/2003, and that's when Dr. Sharma really implemented the cath lab reporting system, the total number of PCIs with stent is like over 72,000. Total number of TAVR, 2,714, and the total number of mitral clips, 257 and growing. So let's talk about an innovation where Dr. Anna Pornikini, while everybody was busy with our COVID, and she was, in addition to working on the side, she really created the STEMI Cath aid with the help of Yulia and Andreas Joveljic, who were really instrumental in working together. It's a healthcare mobile app. It's notable. It's the STEMI Cath aid, and this is going to help to revolutionize patients who've had heart attack, because we know how important time to muscle is. It's an algorithmic approach, improves coordination and communication, essential to the rapid assessment and transfer of STEMI patients, and you're going to hear more about that from Heidi Garcia later, so I don't want to steal her thunder. But really, it's live tracking. It promotes the sense of urgency. It promotes communication from the emergency room to the cath lab. We all know how important constant communication is. Helps to deal with early recognition of patients in shock with STEMI and promote the role of the LV, the left ventricular assist device. Again, it's time-stamped, so that we can use this for performance improvement when we meet monthly to get better and better and better in the care of these patients. It's constantly being improved and updated. Future plans are to really expand this to other urgent conditions such as the aorta, trauma, and stroke. And Dr. Kinney's busy working on that, as well as telehealth app for cardiac rehab. And so you're going to really hear more about this, but pretty amazing. And I don't want to steal the thunder. So again, the cath lab, the secret sauce of the entire team, not only the cath lab, but all of Mount Sinai Heart. What makes us unique is that we all know each other and we all really, really do work together as a team. So to quote Henry Ford, and I know this is Dr. Sharman, Dr. Kinney's quote in the cath lab, but it really is so true everywhere, that coming together is the beginning, keeping together is progress, working together is success. These are the references for the timeline that I shared with you. And so now I'm going to take a few minutes. I'm going to come down, and I'd like to share with you and open and have you meet our entire Mount Sinai Heart team, starting with the cath lab.